My presentation is about how developing countries can use the lessons learned from operational research on infectious diseases for the benefit of the control of non-communicable diseases. Now, as we know, there has been considerable progress made in the control of infectious diseases globally. We all know about the eradication of smallpox, and diseases such as guinea worm and poliomyelitis are also on the brink of being eradicated. So we've made a lot of progress, particularly in the area of vaccinations, diseases that are vaccinable, as well as where there is effective therapy. A relatively new disease such as HIV has experienced quite a lot of progress. So the current campaign is for zero infections in children by the year 2015. According to the global burden of disease, the deaths attributable to non-communicable diseases in developing countries increased from 47.5% to 58.3% over the period 1990 to 2010. The corresponding figures for the disability-adjusted life years was an increase from 36.4% to 48.6%. Now, developing countries clearly face problems with the non-communicable diseases, also evidenced by the rising rates of obesity, the nutrition transition, and so on. Much of the gains that I mentioned before in terms of the vaccines and effective medicines have been translated, the implementation have been realized through operational research. I propose 8 main areas in which lessons learned in infectious diseases could be applied to non-communicable diseases. The process of setting a national research agenda for NCDs, integration of operational research into NCD programs, the use of routine data and disease registers to identify and monitor NCDs, rapid survey methods and analytical tools, rapid diagnostic methods, chemoprophylaxis, mathematical modeling, the process of translation from research to policy and practice. In the paper, I discuss what lessons can be learned in each of these areas. Now, for these lessons to be successfully implemented, there's the need for political will, a clear plan, investment of funds, collaboration, particularly South-South collaboration, and a clear determination for non-communicable disease control programs and infectious disease control programs to work together. In conclusion, there's a clear need for the lessons that have been learned in infectious diseases because of the greater experience that we've had in developing countries to be applied for the benefit of non-communicable diseases. Thank you.